and you sit down and you take their vitals and you take their history and you move them into a room. We don't have time to sit there and chit chat. Now, some people are going to chit chat, and you oblige them the best that you can without being cold and rude, right? Remember the difference between aggressive and assertive, like we talked about in lecture today? So you're assertive that you're moving forward, getting them into the room, but you're not aggressive. Hey, be quiet, let's go, right? Can't do that. Oh, I understand, while you're standing up. Oh, yeah, that sounds great. Oh, I'm so glad. I'm so happy for you. Okay, let's come right into the other room, right? So while you're moving forward and you're guiding them into the other direction, you're still showing interest in that you care, because you do, but we still have to move forward, right? Okay, so keep that in mind, 5 minutes. All right, let's take out our packets that I gave you. Okay, laceration repair tray. I know these are not the greatest copies ever, but you can still see what's there. So on a laceration repair tray, actually let's start out with suture removal, because that's the one that has the least. Suture removal.
Missy,
Yes.
a hole punch for 2?
Yeah, I'll get it after. I might have one in here. No, I'll get it after.
No problem. Thank you.
Okay, suture removal tray. Now, these trays that I gave you guys, it doesn't mean that every single tray that you see out there is going to look just like this. It's not. Okay? Certain doctors are going to have certain things that they want that other doctors don't. Okay? Suture removal tray. Now, remember, we can do suture removals. Okay? So there may be a few things on this tray that you don't want, and there may be a few things on here that you do want that you're going to add to your tray. But what I did is I came up with these trays just of the most common things that you're going to see out there. The whole purpose of doing this is so that you can memorize the names of certain instruments, okay? Especially the main ones that you're going to see over and over and over again. We have a bunch of these miscellaneous ones that even I don't remember what they're called, and I've tried looking them up in the book, but I haven't used them in so long I've forgotten some of the names. But you're going to experience that once you get out there. You're going to be in one area and you're going to memorize all of their instruments, and then you're going to move to another area and forget, because now you're at that new place for 6 months and you haven't been over here for a while, okay? Once you're in whatever specialty you're going to be in, make sure you know each one of those instruments, what they're called, so that when the doctor says, oh, I need another biopsy punch, you're going to say, oh, here it is, and you're going to hand it to them. You're going to know what it is, okay? So we just get, donations from people, offices, and we buy some of them. We just have all different ones. Some of them are rusty because they haven't been used in a while, but these are all real instruments, guys, so be careful with these, okay? Now, on your suture removal tray, like I said, this is what you're going to see most commonly on there. You're going to see gauze. You're going to see an iodine swab stick. So here's your gauze. Here's your iodine swab stick, okay? This has a physical stick inside of it, and then it has like a cotton tip in here. And you see these little notches in here, okay? What you do with these is you grab it here, and you twist it and open it, okay? Now be careful, because there's extra liquid in the bottom of this. And the iodine, it will stain your clothes and skin. So be very careful with these. Now what these are for is to clean the area. Same thing, snail shell. Here's your laceration that the doctor is going to, put together. Going to sew up, and you clean it from the center and work your way out. Same thing. So some doctors prefer this, and then other doctors prefer alcohol around the edge to then clean it, but you don't go directly into an open wound with just straight alcohol, okay? But you still want to have sometimes alcohol on the side to clean up around the area. So what I put on my suture removal tray is the iodine swab stick, the gauze, alcohol prep pad, thumb forceps, okay? That's these here. Now there's all different types of thumb forceps. They just look like tweezers, basically, okay? These are them right here, okay? Here's another one. See how different this looks? It just has a different tip on it for whatever the doctor wants to use it for. Maybe they like that it has the little teeth on the edge here, or these are serrations actually, not teeth. You can actually, can you hear it clicking? They kind of interlock, You're going to see so many different ones out there. Now, those ones that I showed you are without teeth. Here's another set. It has like a blunt tip, okay? These are still thumb forceps. These are just different. Now, the rest of these have teeth on them. See this? They have sharp teeth on the tip of them. And what this does is this allows you to grab tissue. So these are thumb forceps, but they're also referred to tissue forceps because they have the teeth. So what happens is you have this huge laceration here, and the doctor is going to suture it up. They're going to grab that tissue and pull it closed, okay, like this, and they're going to pull it open and explore, look around on the inside. They're going to maybe have you help them hold one closed if it's a real big. You can help out with that stuff. You're just not doing the actual sutures, okay? So these are thumb forceps slash tissue forceps, but these have teeth, okay? So note the difference, just like this, okay? Now, on your suture removal tray, this just says thumb forceps. You don't have to have teeth on there. Some physicians may want teeth, some may not. The thumb forceps are for you to grab the suture, and then your operating scissors are for you to then cut the suture. Now you'll see some of these operating scissors, and again, some of these are real rusty, guys. We don't use them on real people, so but still be careful because they're sharp. See how it has this little hook here on one side? Okay, you guys see that? What this is for is to get up underneath of that suture that you're going to snip, and it helps kind of get up under there, the little hook, and you snip it, okay? And then you grab your thumb forceps. I personally prefer ones without teeth to remove the suture. You're going to grab closest to the skin opposite of the knot. So your knot is over here that the doctor tied. You're going to grab it and pull it through. And when you cut that suture, you want to cut as close to the skin as possible. If you have this suture that's real saggy up here, sometimes they're like that because the swelling has gone down, everything's come together, and you have loose sutures. You want to cut as close to the skin as possible because when you grab a hold of that knot and pull it out, there's not all this other suture that's hanging out here that's touched whatever, okay? Air, clothes, dirt, whatever it's been exposed to. If you cut it up high and then you pull it through, then all of that comes back through the skin and then out.
Plus, you can risk reopening it.
Can you visualize that?
Because mine, I was pulling on it or whatever, and then it started opening again.
That does happen, but if that
so I had to cut both
happens,
sides and do it that way.
yeah, if that happens, they're coming out too soon.
Right.
It's not ready.
Yeah,
So
there
you-
was a point to where it was like that on the end of my incision. Like
Sometimes,
it was
yeah,
big and it was like,
sometimes that happens, yeah. Okay, so that's suture removal tray. Gauze, iodine swab stick, alcohol prep pad, thumb forceps, and operating scissors. So you need to know what the name of these instruments are called as well as these other things. Okay, so that is your example of what a suture removal kit tray may look like. The next one is a laceration repair tray. So this is someone comes in and they've cut themselves on whatever. So there's going to be a repair of a laceration. Again, these are just examples of what you may see out there. Some doctors want other things added, some want some taken away. So the first one is going to be a fenestrated drape. Why? Because this is becoming a sterile tray. It's a sterile tray because if there's a huge laceration, we have to have a sterile area. So a fenestrated drape looks like this, and it says on it fenestrated. What's the difference between fenestrated and non-fenestrated? Fenestrated has the hole in it, okay? So this is the part, and I'm going to show you how to open this properly, but for now, I just want to show you. The fenestrated is the one that has the hole in it. See the hole? Okay? So this is what goes over the area, and this isn't the right way to do it, but I'll show you eventually. I just want to give you an idea of it goes over the area that they're going to work on, right? Okay, so that's the purpose of the hole in this drape. Now, when you're putting it on the patient, you can only hold it 1 inch around. You can't reach across your sterile field. Again, I'm going to go over all that here in a minute. And you're going to more or less drape it on them like this. And you have to instruct the patient, don't go like this. Oh, what's going on? Okay, now they've contaminated this whole space. So the whole space has to be sterile. Okay, and again, we'll go over that more in detail. So this is your fenestrated drape. You're going to need access to that because you are setting up a sterile field. Okay, so this is included with your tray. It doesn't go on the tray, but we're putting it on the tray for purposes of learning what a tray consists of. Okay, your Telfa non-stick pad. Now you'll see on here, nowhere does it actually say Telfa. It just says non-adherent sterile pad. Now this one, the manufacturer is, it's a Medipack. It's McKesson or McKesson, however we say this. And what this is to go over top once this everything is sewed together. The laceration has been sutured. You're going to take this non-sterile pad and you're going to put it over the top before your gauze. Then you're going to put your gauze here, however much. If it's bleeding quite a bit, you got to really pile it on, okay? And then you wrap it in whatever you're going to use, okay? Wrap it, tape it, whatever your office has for that. But the purpose of the non-stick pad is because it's non-sticky. It's not going to stick to that wound when you pull it off nearly as much as just regular gauze would. It still has a tendency to stick a little, but nothing like if you just put straight gauze. So you definitely need to have this. Now, I call it Telfa because Telfa is a brand name. But most people refer to these non-adherent sterile pads as Telfa pads. You're going to hear it out there. People call it Telfa. It doesn't necessarily mean it's going to say Telfa on it, but people call them a Telfa pad. Does that make sense? It's like saying, oh, I want to go get a Coke, when really you have in mind that you really want a Sprite with extra lemon. But you say a Coke because it's kind of like saying soda.
Mm-hmm.
Do you see what I'm saying? Or you're going to say, oh, I need a Kleenex. But you don't really care that it's the Kleenex brand. What you really want is a tissue. But everyone says Kleenex because people know Kleenex as the main brand, right?
Right.
Same concept here with Telfa pad. People are going to say, oh, go get me some gauze and give me some Telfa. Okay, but if your office orders from this manufacturer, it's not going to say Telfa on it. Is that making sense? But I just like to expose you guys to that word. So I wrote it on here. It says Telfa on it so that you know what we're talking about when it's people say Telfa. Okay? Telfa pad, gauze, iodine swab stick. We went over that already. Alcohol prep pad. Again, you may not necessarily need both for whatever you're working on, but some physicians like to have access to both of them. Especially, like I said, if you use the iodine swab stick and you've cleaned the area, you don't necessarily need it all around this whole area. So afterwards, you're going to go in and clean that area up around it with your alcohol prep pad. Okay, dressing or thumb forceps. We went over that again, with or without teeth. Operating scissors, here's these. So many different choices. Okay, this one, it doesn't have that little hook on it. See, this one has that little hook. This one does not. This one's, again, really sharp. Be careful. Some of them have a blunt edge. This one, and the other thing is some of them are curved. See how that's curved? This one's not. All different ones, guys, still considered operating scissors. Hemostat, here we go. This whole thing is full of hemostats. You see this? Okay? All different sizes. Okay? All different shapes, curved or not. It just depends on what the doctor wants. Now, remember this, the ratchet here on the bottom? Ready? Click, click, it holds it tight. Okay? It takes practice. I want you guys all to put your thumb and finger through, and I want you to practice snapping it together, holding it tight, and opening it up. Hi!
Hi, I don't want to disturb what you're doing right
No,
now.
go ahead.
I just wanted to show off this lovely, lovely poster board of art. I just wanted to let you guys know, because I didn't mention it the last time that I spoke with you, but I wanted to let you know that you do have the opportunity to do projects like this, especially if you do like anatomy and physiology, those subjects. A lot of times if you do a diagram or a project, it'll help you remember things a little bit better. It'll help trigger your memory. Sammy's the one that did this project, okay? She wanted to raise her grade, and I gave her the opportunity to do a project. You guys, I want you guys to know that you all have that opportunity to do that, okay? If you're trying to make honor roll and you're trying to keep that A, sometimes doing a project will give you a little cushion just in case you don't do so hot on your test. But the most that we can ever give for projects are 5 points, unfortunately. That's all the school allows us to do. But 5 points can make a difference between a B and an A. And if you're trying to make honor roll and we're trying to make that transcript shine, trust me, if you do a project all the time, it's really gonna benefit you, okay? So, it can be a report, all right? It can be a poster board project like this. You can do something 3D. Look at your subjects that you're learning here. Your teacher will probably point out when it's a good opportunity for you to do a project. Right now, you're doing surgical instruments or surgical assisting. You wanted to do a project on the various types of instruments or your tray setups. That would be nice too. That's always exciting, or how to clean a tray, okay, step by step. It might be kind of tedious at first, but then you get into it, you get motivated, and then you're glad you did it when you did it. Ultrasound is very high tech. They've gotten 3D with their poster boards, and I'm like, whoa, they're taking it to another level. So I want you guys to know your resources and all the opportunities that you have to help advance you with your grades, but it doesn't do you any good if you don't do anything with it, right? Okay, and I hope you guys all had a wonderful weekend, and I'd like to display this somewhere. Maybe I'll show it off in my office. I don't know. I'll figure it out, okay? I can't hang everybody.
Want to know so we can look and see what's on.
Well, why don't I leave it? Why don't I leave it for today?
Yeah,
You know?
we can do that.
Put it in here, and then, I don't know where to put it. I'm
We just
gonna
put it on the
it
board,
right
that'll
now.
be good.
Okay, did everybody have a good holiday weekend?
Yeah.
Everybody had fun?
Yep, yep.
Good, good. I'm glad to hear that. I'm glad to see you're safe.
Thank
Miss
you.
Parker.
Okay. So yeah, sometimes she'll allow that, depending
But is
on
that
where you're
only
at and what's going
Like
on,
on
and
one text, or you can do it for every single.
that I'm not sure,
Yeah.
because this is a little new.
That's what I'm saying.
So we'll have to, we can ask her on that. Yeah. Okay, moving on. Okay, operating scissors and hemostats. So again, there's all different hemostats. You know, some of them are just longer than others, like this one. See how long this one is? And then this one's just a little bit shorter, see? Okay, they're all considered hemostats. The doctor's preference. Oh, I don't like this one. It's too long. I need the one that's curved on the end. I need that really short one that's curved. Oh, I don't like the curved. I need the one that's really short. Oh, I need that one that has the needle holder in it. Some hemostats also, if you look, it'll have a little tiny hole right here in the bottom, and this particular one doesn't, but that's how they grab their needle to do sutures, and they use that like that. They grab it, okay, grab it, okay. All different ones. They're all the same, but a little different. Okay, but all of these are hemostats. Okay, we have a whole bunch. So that's the laceration repair tray. Then, again, just an example, right? Here's an example of the incision and drainage tray. So you need your fenestrated drape. You need your gauze, your hemostat, dressing or thumb forceps. Here's your blade and knife. Why? Because the doctor has to cut into whatever, this ingrown hair that's ginormous, you know, some foreign body that's jammed in there. They have to cut it and open it up to get it out. Incision and drainage. So it's infected, they need to drain it. Okay? These right here are examples of your blades, and they have a handle already included with them. These are disposable, so we don't open these and take them out. It's just for me to show you guys. But a lot of physicians will order only disposable instruments too, but that gets really expensive. So when they have instruments like this that you can clean and then autoclave and sterilize, they can use them over and over and over again. Does that make sense? Mm-hmm. But these particular ones are disposable ones, just so you can kind of see an example of those. Okay, blade, knife. Oh, and then we also have this one that I like to show you guys. See, this is the knife handle, but it doesn't have a blade on it. So a lot of times they'll use a reusable knife handle, but then they order the blades disposable, okay? And it comes in like a little packet like this, but it's all by itself, and you open it up and then you push it slides inside of it. You can barely see, but has a separation here. And it slides inside for the knife blade. Does that make sense? But then that always gets taken off into the sharps container. Sometimes you can use a hemostat to take it off. It depends on the manufacturer how they take them off. Sometimes you can go like this and pop it. It just depends on the manufacturer. Okay, so that's the knife handle that's reusable. Iodine swab stick and alcohol prep pad. Okay, so this one's fenestrated drape again because we're going to be putting it over top of whatever, they're draining. Now, a bunch of these are just miscellaneous instruments. I wanted to show you guys some of these. These are towel clamps. I don't really know why you would use these. I personally never used any of these. They're very sharp. Be careful, but you can touch them, feel them, move them around. Okay, we have a bunch of those.
What are those for?
It's called towel clamp, but again, it doesn't really make sense to me because it seems really sharp. And I mean, you can use it to grab stuff, but then it's hard to kind of get rid of. Yeah, so, but these are called towel clamps. I looked these up recently because I was like, what are these? So those are towel clamps. All of these things, these are either probes or retractors. These are to hold skin back. So you get inside of an area, you hold it back, okay? This one you can experiment and probe around in. Oh, what's in there? What's going on? That's what all these are. Okay, all these things. All of these, that's what these are, retractors and probes. This one, I don't know for sure what this one is called. This is some sort of plier, but it's not a plier, right? That would be a tool. We have instruments. So this one, I'm not sure what this one's called. We could look it up. These guys are biopsy punches. Here's another towel clamp. Oh, see, this towel clamp has blunt ends. See that? They're not sharp, but it's still considered a towel clamp. See that? Same but different. These are all biopsy punches. These are very sharp. Again, these are all real instruments, guys. Be careful. Okay, so what happens with these, and see how they're all different diameter? Okay, so we have a mole. The doctor doesn't like the look of it. Okay, they go in, they numb it up. Do we numb up the area?
No.
No, only the provider, right? So they go in, they numb it up. They take this biopsy punch, they put it here, and they push and twist, 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 and then they pull it up, and then inside of that is your mole or your freckle or whatever they're taking out to look at. Yeah, skin sample, whatever it is. And then you hold your little formalin jar open for the doctor, and the doctor goes bloop, just like that, and it drops in there. And then you put your label on there, who it is, what time it was, what the doctor was, where it came from, where it's going, all of that information. Okay, and then you send that off to the lab. So that's what these biopsy punches are. They're just different sizes for different whatever you're taking out. Okay, again, very sharp, be careful. Okay, this one here, this one takes out staples. This is a staple extractor. So this goes, you can see the little hook right here, goes right underneath of that staple, and then you squeeze it, and it goes like this. Okay, comes out, you take it out. Just like sutures, but staples. Knife handle, like I told you guys. Saving this one for last. Another towel clamp.
Cuticle remover. Yeah, that's we saw that one. It looks like
This one?
no, the one you said you're saving for last.
Oh, this one?
It looks
This
like
one's
one
a
of the
great
cuticle
story.
removers.
Yeah, this one's
First thing
great.
I looked at.
I love that one. This one is a curette. This is to remove earwax. I mean, they use it for tons of different things, but the most common is to get that earwax out. It's like a mini ice cream scoop, okay? But the patients will come in, they can't hear, they got all this pressure, they have pain. The doctor put a couple drops of oil in there, try and loosen it up a little bit, and then they get in there. You can even do an ear lavage, which you're gonna learn next module. And then with this, you get in there and really dig that out. Oh, these are great. I always had these at home.
I was just gonna say, do you own one?
I love these. These are my friend.
I love the ears.
Okay. This one is your best friend ever. Okay, this you're gonna carry around in your pocket. These are bandage scissors. These are fabulous. See how it has this blunt end and then sharp? Okay, So you have this gauze, it's wrapped around. You got to get that bandage off because you're going to check it. They're here for a wound check today. You're going to take out your bandage scissors out of your pocket. You're going to carry them all the time. You're going to love these. You get up underneath of that bandage and then you just cut it right off. Just like that. These are your bestest friend, I promise you. You'll have like 2 or 3 pair. They're awesome. And then, oh no, I do have this one too. This one's fun. And then there's this. And actually, I don't know what the name is for this guy. We'll have to look it up. But this one is wonderful. This one, you can use for a lot of different things, but what I always saw this used as is a ingrown big toenail remover.
Yeah, like the cute.
Yeah, so what happens is you have the big toe and it's there and it's all swollen, and they already came in a week ago and the doctor gave them antibiotics to try and get that infection down because, oh, when it's really bad, you can't even walk, okay? But we have to remove that section of that toenail along with the root. So what do? We go in and we don't, but the provider numbs up the whole base of the toe. So they're doing a nerve block. So they're blocking specific areas to get those nerves blocked in the whole toe. And then what they do is they take this very, very sharp edge and they get under there and they get and they're clamping the whole time getting that toenail. And if it's not numbed up enough, your patient will be climbing the walls and you'll know that they need more and your doctor will give them more, okay? So they and they clip that and then they get themselves a really good hemostat like this and then they grab a hold of that nail and they clamp it and then they and out it comes. And then there's lots of blood and then you're over here with your gloves and your PPE on, which stands for what?
Personal
Personal
protective
protective
equipment.
And you got all this gauze and you then go and you cover that toe because it is bleeding like everywhere. And you have some chucks underneath of it that's absorbent or those tidy towels because it's going to be dripping. It's awesome. But man, oh man, does that give them relief because that toe is infected and it hurts. Okay? So that's what that is. That one's severe. Yeah, that one's a good one. And then this one, same thing. I don't remember what the name of this one is. I call it a rut-rut.
Isn't it like a roto?
I don't know what these are
Roto
called.
cutter?
Well, you have to look this one up. But again, I call it a rut-rut because what happens is this is checking to see if you're numb or not. This is what they do, especially in C-sections. Okay, when you're supposed to be numb because they're about to cut you open, right? And then they take this and they go, see why I call it a like this, okay?
Call it brat.
Again, we got to find the name of this because I don't remember. Something wheel. Yeah, we got to look this up. But it's very sharp, people. Be careful. Don't touch it, okay?
Like a roto wheel.
And they kind of push a little bit. They put pressure like I'm not doing right now because, you know, I'm not numb.
Not numb.
And it's not sterile. And if the patient goes, ooh, I feel that, they're not numb. And they need more.
Give them the juice.
But that's what this is for, okay? So those are just some of the instruments that we have. There's thousands of instruments out there, guys. I don't know if thousands is realistic. Hundreds for sure. There might be thousands. Because there's so many different specialties and so many different individual specialties just within just a hemostat, right? So many different. So this one we'll just set aside because you don't need any of those. But all of these you're going to use to set up your tray. So I want you guys to grab trays, work together, pull out these that I gave you, and I want you to set up your trays. And you're going to say, okay, this one needs suture scissors, or what do you call those again? Yeah. And we need this, 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 and you're going to set it up on your tray. And you're going to practice and practice and practice and actually touch them. Does that make sense? Operating scissors. Thank you. Okay? So ready, go.